paint a picture of what the current stats look like for those living with Alzheimer's and other forms of dementia in North Carolina, and really show that it's pervasive in our community and see if anyone's interested in getting involved. Excited to see Todd on here. He is a part of our walk planning committee this year. So thank you, Todd, for your support. We definitely appreciate it. So I'm going to pull up our PowerPoint now. And I would like to apologize in advance for my dog in the background. After over a year of working from home, she has developed severe separation anxiety and always seems to find the camera no matter where I change the angle to. So starting out at the Alzheimer's Association, our mission as an organization is to lead the way to ending Alzheimer's and all other forms of dementia. So while we are called the Alzheimer's Association, we focus on anyone that is experiencing cognitive decline. So that's Alzheimer's, that's Lewy body dementia. There's about 5 or 6 different types of other dementias that are kind of covered under that fold. So it's a lot of people that we serve. So we do that by trying to accelerate global research, driving risk reduction and early detection, and maximizing quality care and support for those that are living currently with the disease and their families and caregivers, because it is certainly a disease that doesn't stick with the person suffering through it. It goes to families. It's really much a disease that affects a lot of people. And ultimately, our vision is a world without Alzheimer's and all other dementia. So that's really important. If you've had a loved one that has gone through the disease, you know how challenging it is to see them going through the cognitive decline, all of the changes in temperament and even dietary things. Some people lose appetite, can't eat, just normal things that we don't even think about as a healthy person. Really supporting all those living in that situation. So wanted to throw up some statistics. So these are national statistics that cover both Alzheimer's and other dementias. So right now, 1 out of every senior that passes away is dying from Alzheimer's or another dementia. So it used to be heart disease was the largest one. Heart disease is actually on decline right now due to people understanding, getting more exercise will help you in your chances of preventing heart disease. Alzheimer's is the opposite. It is rapidly increasing in terms of prevalence. So right now it's 1 in 3. By 2050, it's expected to be 1 in 2 that is passing away from the disease. There are currently over 6 million Americans living with Alzheimer's disease, but that number is deceiving because quite often people are passing away from Alzheimer's. So that number is always changing, and it doesn't truly reflect the number of people that have lived with it over the last few years, because that does not include those that have passed away already. It's currently the living population. Over the last year, this is a really interesting number. Alzheimer's and dementia deaths have increased 16% just in the last year due to COVID-19. So that was way more than expected. So we know that if you're having Alzheimer's and dementia, socialization is really important. Getting out and having conversations with people, like Dawn has shared in past virtual mixtures, it's really important to chat with people. And, those conversations really do make a difference in your life. So it has made a huge negative impact on the people living with the disease, which is really unfortunate. Alzheimer's is currently one of the most expensive health diseases in the nation, costing $355 billion by the end of the year. So that's just a lot of money going towards a disease that ultimately has no cure right now. So it's kind of money being thrown away. So that's why research is so important and critical in what we do as an organization. You can see the numbers that have increased from 2019 to 2000. So it's pretty significant in terms of the number of people that have passed away from the disease, and then the prevalence of the disease as a whole. By 2050, so I talked about the numbers of cases increasing, the costs are expected to reach over $1 trillion by 2050. So again, it just shows it's rapidly increasing for these populations here. So it is more prevalent in those of color. So if you're an African American, you're 50% more likely to develop Alzheimer's. And then it goes along for Native Americans, Asian Americans, and Hispanic Americans. They're not quite sure why that is. A lot of research is being done on health disparities, if it's a health equity issue, if people don't have access to healthcare, and maybe that's part of why it disproportionately affects those communities. Is there something in the genetic makeup that fuels Alzheimer's and other dementias affecting populations of color in a different way? So we as an organization right now are really focusing on research to understand these numbers and why it is so prevalent in these communities, and what can we do as an organization to prevent that in the future. So really getting these numbers to be equal across all populations, or if that's not possible, understanding what markers may be making these communities more susceptible and what we can do to help that. So if it's diet-based choices, that could help. If it's health choices like getting out and exercising more or sleeping more, if that will help brain health. I'm really trying to understand where these numbers are coming from is what we're doing as an organization a lot of right now. So these are some North Carolina statistics. So currently there are 180,000 North Carolinians living with the disease. In the next 5 years, that number is expected to go up to 210,000. So based on the population as a whole in North Carolina, that's a pretty big chunk. So I'm sure several of you on the call know someone that's had either Alzheimer's or dementia and has passed away, or maybe currently living with it. So that's a pretty large number. And then it kind of breaks down the different hospitalizations, the Medicaid dollars. That $1.3 billion in Medicaid funds is just in North Carolina alone. So it's really a big public health crisis, and figuring out how we can assist those living with the disease and making it more affordable on both our healthcare systems and for individuals going through the disease. Because it is certainly pervasive in our community, whether it's Surrey County or North Carolina as a whole. These numbers are continuing to rapidly increase, unfortunately. And there's a little bit more. So the caregiver piece is really important for what we do at the association. So we know it is so hard on those living with Alzheimer's and dementia, but it's even more difficult on the caregivers. In North Carolina, there were 358,000 caregivers last year alone, which is those that can be paid caregivers or family members or friends that are helping take care of a person. The total hours of unpaid care, so that is hours that families are committing on top of their professional lives, their own families, if they have young children, taking care of those. So it is a huge, huge issue in North Carolina specifically, and something that we're working right now with our advocacy team in North Carolina to work with our Senate and House representatives to get legislation passed to fund respite care, which allows caregivers to take some time off and have paid nurses come in the homes with Alzheimer's and dementia patients. So that way they can get some rest and kind of fix that total hours of unpaid care, because it is super, super hard on those that are giving support to those living with the disease. So as an organization in North Carolina specifically, that's one of our big focuses in 2021, is really giving assistance to those who need it, who are caring for their loved ones. So we have 4 pillars at the association that we focus on. Care and support is one of those. So we have a free 24/7 helpline that anyone can call if you have questions about the walk, if you want a program for your company, or if you are living with someone that has the disease, or maybe you were recently diagnosed and have no idea where to go. Alzheimer's and dementia is a very, very stressful disease. And oftentimes you can kind of get in a rabbit hole if you're Googling online, or you can't find the right info, or maybe your doctor can't get back to you in enough time. So this helpline is truly a lifeline for people that need it. We have about 4,000 calls every single week nationwide. So just think, even during holidays, we see an uptick in calls because it's really stressful for those that are living with loved ones that may not remember them. At Christmas, we saw a massive uptick because people had been isolated. Christmas things were a little bit better with COVID, so people were going out and visiting their loved ones, but then their loved ones didn't remember them or didn't know them. And it was a huge, huge influx of calls on people needing support and kind of guidance on how to manage and navigate the disease. So that is by far and away one of our best resources that we have. We have Alz Connected, which is an online repository of information, kind of like a social media networking site where people can go and chat with others who are going through the disease, may have a family member, just want an online connection with someone that understands understands really what they're going through. And then we have nationwide more than 4,500 support groups. In a pre-COVID year, we had one in every North Carolina county so that we were in the communities. We have volunteer support group leaders that were really instrumental in leading support and a great place for people to talk. Obviously, now we have moved online and are still hosting online support groups. So we've moved away from the specific location, so versus Surrey County or our Charlotte support group, we now have targeted support groups. We have a men's support group, we have a senior women's support group, we have a support group for our church community so that way they can get together. So we've really targeted to specific groups to help them connect with others during this time. And we've had a lot of success with our virtual support groups. Obviously, we would all love the in-person connections, but we've seen a lot of success with our online support groups, and information can be found on our website with those if you're interested in learning more or know someone that may benefit from participating in those. Awareness is also a huge part of what we do. As a nationwide organization, we have over 20,000 educational programs and workshops annually. So what those look like, we can come and speak to a business or a company or have a Zoom call and share the 10 early warning signs of Alzheimer's or dementia, or specific targeted programs for each of those providers that are interested in for their employees, or maybe it's a church group. We speak at a lot of church groups with senior groups that are just interested in learning more about the disease or how they can prevent it, or any of our resources. We have a couple hundred different topics that organizations can choose from. So it's really a breadth of information that people can use as a resource to help educate and spread awareness for the disease. We have far-reaching campaigns. Right now, we've been doing a lot of online campaigns because we're not out in the communities as much as we were. But the more that people understand the disease, what it is, what it looks like, and how it affects those around them, the more impact we can make. So awareness is huge for what we do as an organization. And then we have our website, alz.org, which has a massive amount of information, from updates on our research projects that we're doing to information about our support groups, our education programs. Our website is a one-stop shop for everything you need in terms of Alzheimer's and dementia information, and a really, really great tool for those in need. Our other two pillars are research and advocacy. So the Alzheimer's Association is the single largest nonprofit funder of Alzheimer's and dementia research in the entire world. We are only behind the US government and the Chinese government. So a lot of our funds that we raise from the walk go directly to research. So we have international research grant programs. What I think is really nice about our association is we are not just bound within the perimeters of the United States. The association says that we don't care where the cure is found from. We just want to be a part of that research. So we are really open to anyone who has new, fresh ideas and research studies that are looking into a cure for the disease, understanding the disease more and the populations it's affecting. We currently have 3 research projects going on in North Carolina specifically. So that's really exciting. We have a lot of fantastic medical institutions in North Carolina. So we're working with Wake Forest. They have 2 studies going on right now, and then Duke University. And those are specifically looking, one is looking for a cure, and then one is exploring our health disparities and really figuring out how we can make Alzheimer's and dementia care more equitable for those in need. So research is definitely at the forefront of what we do as an organization. And as I talked about earlier, advocacy, we advocate both on the federal level and at the statewide level. So that is for policy that helps those living with Alzheimer's and dementia. We founded with our Congress and senators at the federal level, the National Alzheimer's Project Act, which was passed last year and increased funding exponentially for the National Institutes of Health and our Defense Fund to really accelerate our research. We ensure federal policy is adhered to and really advocating for those in need. And then we have a nationwide network of advocates. So we have a ton of volunteers in North Carolina specifically that advocate at the statewide and federal level to really make sure they're being heard. So that's people who are living with early onset Alzheimer's. So we have several volunteers in our network in North Carolina that were diagnosed with Alzheimer's at the age of 53 and 55. So Alzheimer's is increasingly being diagnosed earlier. So it's not just an older person's disease as a lot of people picture it. We have a rapidly growing population that are being diagnosed in their early 50s, early 60s, which is much earlier than in the past. So really making sure that people understand who we are and what we're doing is critical to us as an organization. So this is our website if you're interested in learning more about any of the things I've gone through so far. So it's alz.org is the national landing page. And then to find North Carolina specific, you can just do /North Carolina. And this is what it looks like. So you can see all of our info at the top. That's the national info. And then the purple bar is our North Carolina specific info that we have. So to help fund all of those things, we have the Walk to End Alzheimer. So as Travis said in the intro, there are over 600 nationwide events that take place every single year to raise awareness and funds for Alzheimer's. Our Surrey County Walk is very much one of our strongest walks in North Carolina. We are very excited to be walking in person this year on September 18th and be back in the community and really walking with a bunch of you, hopefully, and then our community members, because it is so important to be out to have that community-based support for what we're doing as an organization and everyone wearing their purple and hopefully a nice, beautiful day, fingers crossed, in the park. So last year, even with COVID, we had 198,000 participants across our 600 walks and raised over $64 million, which is truly incredible given all of the turmoil at or with COVID. So you can see those are some Mount Airy pictures. We did not have the walk in person last year, but we did have a planted promise garden with our flowers in the background and then highlighted all of our sponsors. So you can see a couple of our sponsors from last year and then 2 of our walkers. In Mount Airy alone last year, we had 142 walkers made up of 35 teams. We had 11,500 in sponsorships, and you can see all of our sponsors to the right of the screen on the back of the t-shirt. And our participants raised over $30,000 with a total of just under $42,000. So we were really excited that the Mount Airy community came together in support of our mission and what we're doing, even during a super crazy year. So thank you if anyone was a walker last year with us or a sponsor. We certainly appreciate your support and hope you'll join us again this year. So our Walk to End Alzheimer's website is where you can register, you can create a team, or you can donate. This is our 2021 walk page. So it has our walk date. You can add it to your calendar, and then it'll track how many participants and teams we have along with our current funds. We're doing really great this year. We have a goal of $60,000 and we've raised just over 11,000 so far. So we are working towards that goal, and hopefully we can hit it, if not surpass it, and raise as much awareness in the community as possible. I think it's really important after kind of a crazy year last year to be back out in the community and share that we're still here. We have not stopped any of our services. In fact, we've increased a lot of our offerings to meet the needs of our constituents during the last year and sharing what we are doing as an organization. And then the direct link for the website is act.alz.org/Mount Airy. So if you use that link, you can go register, donate. Joe has a team already registered, so you can go donate to Joe if you don't want to have your own team. I'm sure he would love that and get his stats boosted a little bit. But it's really a great resource for those who are interested in participating in the walk this year. So how you can support those living with Alzheimer's or another dementia. As I said, we have a great team option available. You can register on our website. Teams really make the biggest impact on the walk. You don't have to fundraise to have a team. It's more of the awareness piece. So you can have a team walk physically at the walk and join us on September 18th, or you can just have a team virtually and support and share on Facebook that you're supporting, because every post that someone makes, every email that's sent, every word of mouth conversation that happens raises awareness. And that's really our ultimate goal this year. So we would love for each of you to have a team. As I said in past meetings, we will highlight each team that registers from the chamber several times throughout walk season on our online platform, the walk website, and our social media with your logo directly linking to your website. So that way we can give you guys some promotion for supporting us and really hopefully build up our chamber member teams for this year. As Todd said at the beginning, we do have sponsorship opportunities for the walk. They range from $500 all the way up to our presenting level. And we do have an early bird sponsor special going on right now through June 30th. I can give more details for anyone that's interested. I'll include my email and our website link at the end in the chat box, so that way you can reach out if you have any questions on that or would like to learn more. Sponsorship opportunities, as you saw, every sponsor goes on the back of the t-shirt. You go on our website with your logo and a direct link. We do heavy social media promotions. And then we have an email database of over 30,000 people in North Carolina that receive emails with your logo and website information. So if you're interested in learning more, let myself or Todd know. We'll be glad to chat with you about sponsorship opportunities for the walk. If you don't want to have a team or don't have the capacity to sponsor, you could donate. Donations can range from anywhere from $1 to as much as you want. Joe has his team up and running. So if the first two options aren't for you, you could do a donation and support his efforts for the walk. But every donation definitely makes an impact. A lot of the money stays in North Carolina. What doesn't stay in North Carolina goes to our research efforts that are happening currently, or research that may be funded, that they're exploring new studies that are going on. So those funds do make an impact. I know a lot of people are concerned, especially now with COVID, that donations may go to overhead or funding a lot of stuff. We do have other funding that kind of covers a lot of our internal operations pieces. So our donations from the Rock truly help fund our program services and research that we do as an organization. So it makes a huge impact in the money that we're raising. It stays in the community, and we think that's really important as an organization. We also have a Walk to End Alzheimer's Mount Airy Facebook group. So this group is where all of our latest updates are posted. It's a really great way to interact with us, see what's going on. We share and shout out our sponsors, our teams, and everything going on there. So if you haven't already joined and just want to learn a little bit more about what we're doing and get engaged, that's a great way to do so. So for contact information, as Travis said, I work with our walk specifically. I cover a couple areas, but Surry County is my main focus. But then we have a programs manager that works out of the Greensboro office that covers the Surry County and surrounding areas with our programs. So as I said, we have a ton of programs that we offer on an educational basis for free, no obligations, but we just want to spread awareness and really give people the tools they need to be successful in managing the disease or kind of walking through the journey with their loved ones. So if you're interested in having a program done virtually or in person when we're back in person, whenever that may be, please reach out to myself or Karen Owens, and we would be glad to schedule that for your business or organization or church group or Rotary, whatever that looks like, and speak on specifically a certain topic for you guys. Okay, so that kind of covers everything that we do in our two pillars, our programs and what we offer, and then our ultimate driver of those things, which is the walk. So happy to answer any questions you may have about any of the things we've covered, or maybe something I didn't cover, but you're interested in learning more on.
Don Masur has asked, how do the numbers in the United States compare with other nations?
So in the US, numbers are significantly higher, and they're not sure why. I think part of it is we have a lot more resources in the United States than some countries, especially when you look at developing countries. Our healthcare system in the United States, while obviously the cost is higher than some other countries, we have a vast repository of information and information sharing that goes from doctor's office to the national level for the government to really kind of pull all those informations together and collect and see who's living with the disease. So I think it's a little bit of our population in the United States is bigger than a lot of nations. And I think right now, some of the research that's going on, not necessarily studies that we're actively funding in North Carolina, but our other ones are looking at what health factors go into people developing the disease. Is it our foods? Do processed foods kind of tweak with the brain and what's going on there? Does that make an impact? If people are working more, there was a study that just came out a few weeks ago that directly correlated. If you sleep less during the night over a long period of time, you are more likely to have Alzheimer's or another form of dementia. So what habits do we have in America that maybe other countries don't necessarily have? So we're looking at a lot of different things. So I think there's several factors that play into it, but we do have currently, and probably for the foreseeable future, a higher prevalence of Alzheimer's and dementia than some other countries.
All right. And we also had a few questions from Brenda McGallop with Grime Guru in Winston-Salem. First thing she asked was, what is the greatest discovery made in the last 5 years for the disease?
That's a hard one because I think when we have people ask us questions, it's normally very specific to what they're interested in learning, kind of like Dawn said, is there more of a prevalence in the United States than other countries? Some people are really interested in what's the cure. We have not found a cure, but currently it is an FDA review. So hopefully they were supposed to originally approve it in November, but it got kicked for more review by the FDA advisory committee. There is a medicine called Adjukanamab. That medicine is supposed to help treat early symptoms and it directly slow the disease growth. So currently there are no medicines at all on the market that are approved that treat Alzheimer's. This medicine, if approved, will help that. So it won't, you don't take the medicine and it will stop Alzheimer's like, radiation treatment with cancer. It won't make it go away, but it will severely slow the growth, which is huge and a great step forward. So we are hoping as an organization, our president and our advocacy team has been heavily working with the FDA to work on getting that medicine approved because it is a huge first step. It's obviously still not the goal, but I think in the last 5 years, that is by far and away the biggest improvement we've made, and we have directly helped fund the research for that product. So we're very much hoping that that's approved. Our website is always updated with info about Adjukanamab and kind of its status with the FDA. And if it doesn't get approved, the company that made the drug is going to go back to the drawing board and see if they could run more clinical trials. What can they adjust to get the FDA approval? But once that drug is approved and on the market, that will be a game changer for people who are early detected with Alzheimer's and dementia and slowing the growth and I think changing a lot of outcomes for people.
Is there a significant difference in the number of men or women who contract this disease?
Women are more likely to develop the disease. It's about 70%. If you're a woman, you're more likely than men, but it also tracks, African American women are more likely than white women. Native American women are more likely, and it's the same for men, but women overall do have a higher prevalence of the disease.
Russ Parmley from Legacy missed a few moments at the beginning, but wanted to know how connected is Walk to End Alzheimer's research and advocacy with other forms of dementia like the Lewy body dementia, stuff of that nature.
So most of our research that we work on looks at multiple different facets. So currently we have 3 studies going on specifically in North Carolina. They're not just looking at Alzheimer's, they're looking at Alzheimer's and other dementias. So we're very careful as an organization. While we are the Alzheimer's Association, it started back in the 80s, and the person who founded the organization was really passionate about Alzheimer's, but over time, our organization noted that it's not just about Alzheimer's, it's about other dementias too. And using our huge scope, we are one of the largest nonprofits in the country to really push information across ours, because there's a lot of similarities between Alzheimer's and Lewy body dementia or frontotemporal dementia. So it's all important to us as an organization. So while it is Alzheimer's Association, we're working on all types of dementia and Alzheimer's. And just to clarify, Alzheimer's is a form of dementia. So it's just kind of the one people most know about, but it is just a form of dementia as well.
Joe Zelzik has asked, is there a time and location for the Surrey walk?
So it will be at the park where we normally have it. We are still waiting to announce a time. We are very much looking forward to that June 1st. Hopefully, everything getting back to normal in North Carolina and things opening up. We'll likely still have social distancing and, health precautions taken in place when we have for the walk. So we haven't quite declared a time yet. Normally, it's in the morning to early afternoon time frame where we have the walk. Registration starts about 9 or 10, and then we have our walk around 11 and wrap up around 12:30. It may be a little bit later if we have to kind of stagger entry. So as soon as we have that info, we'll post that on our website and share that on our social media.